Hello, I'm Dr. Marla Shapiro, and I'm a past president of the North American Menopause Society. And today I'm joined by Dr. Sharon Bober, who's a senior psychologist at the Dana-Farber Cancer Institute. She's an associate professor in the Department of Psychiatry at Harvard, and she's the founding director of the Dana-Farber Sexual Health Program, which provides consultation and personalized rehabilitation counseling for individuals as well as couples who face changes in sexual health during and after cancer. Welcome.
Thanks, Dr. Shapiro.
So often when it comes to cancer and the beginning of the cancer journey, the focus is on the diagnosis and the treatment, and that's really where we focus. But there are a lot of common sexual health problems that can impact an individual, a couple, and often we don't talk about them. So can you open the conversation for women to understand what are some of the common changes that can be experienced but may not necessarily be recognized that is because of the cancer itself or whatever we're using to treat the cancer?
Absolutely. It is certainly very common for women to go through menopause, whether it's either short term or long term, because of the kind of treatment they have. That might be chemotherapy, that might be a kind of hormonal therapy, or it might be any type of radiation or surgery which affects ovarian function. When that occurs, it is often the case that women notice changes in things like vaginal dryness, changes in arousal or desire, and we often see that that really has an impact on the experience of sexual activity. Similarly, the changes are physical in terms of body changes, right? So when we talk about having, for example, mastectomy surgery or any kind of change that impacts really the sense of being whole in your body, lots of times people really feel a sense of either physical discomfort, certainly temporarily, but often longer term, a change in body image, just in a change of how we perceive ourselves. And it's not just about being attractive, but it's often just about feeling whole, and a sense of being comfortable in our body. And then I think often we see changes just around how you talk about that with a partner, or how do you date again? Just what does that mean in terms of how you express to somebody, how you may need things to be different or slow or changed in the context of sexual activity. And then often it's not uncommon. That's sort of how we think about ourselves, just in terms of thoughts and feelings about one's sense of being attractive or being a partner. There's a psychological piece that's often somewhat distressing as well.
I think it's so important to be able to prioritize this because we talk about, recovery or the journey towards recovery, but often we don't think about sexual recovery or sexual health recovery. So what do we mean by that? And how do we make sure that this is a journey that we are encouraging for us as women to make sure that this is part of our journey?
Yeah, well, first of all, I appreciate the question because you use the word journey, right? Which really implies that this is a process. And I think first and foremost, that's not something that often people get information about, right? The assumption is that you're done with treatment, you look great, and that women hear that all the time. For example, maybe after you've had a breast reconstruction and you get a lot of feedback about how great you look.
Mhm.
But it's a good example because if you have no sensation, no nipple sensation, and that was a big part of your sexual experience, there's often a disconnect between that feedback that you look great, but you don't feel the same way, and you might not know what to do with that in the context of maybe sexual activity or talking with a partner. So I think that first and foremost, we really need to sort of help people recognize that often this takes time, and people really need skills and strategies in terms of how to sort of put the pieces back together, because sometimes things may be the same as they used to be, but sometimes they may be different. And again, something like breast surgery is a good example. That loss of sensation is permanent, right? So what do we do to help people have a sense of self and sexuality and pleasure when we may need to remap some of those habits or former activities in a way that expands people's repertoire?
I like the fact that you use the word skills and strategies because often healthcare providers will not necessarily prioritize this or bring this up or have a discussion or just include it in part of the specific questions when you go to see your oncologist or your primary care provider. They'll ask you how you're doing, but that doesn't necessarily mean that you're comfortable initiating a conversation about your sexuality, or you may not even recognize that the issues you're having are related to the cancer or the treatments. So how do we empower women to know what questions to ask if the healthcare provider or part of the team is not initiating that conversation and opening the door?
Well, first and foremost, I would just say, even though your healthcare provider may not bring up the topic, it does not mean that this is not something we can talk about, right? It does not mean that there is that help is not available. And I say that with all due respect. Many of our medical colleagues simply don't get training in how to talk about this kind of thing, and often, will tell us that they don't want to make anyone uncomfortable or they're not really sure what to say. But that doesn't mean that there isn't help. It just means that we have to kind of broaden the circle and often help people sort of figure out who they need to see and what kind of resources are available. I would say for patients in general, it's really important to sort of think about first and foremost what is different and what may be distressing in some way, and to really make a point of saying to your healthcare provider, even at the beginning of a session, I know this might not be something that we've talked about before, but I really want to make sure that we take a few minutes to talk about sexual health because this is on my mind. Start the session with that. So you're putting it right on the agenda. Um, and you can also say to your provider, I'm not sure if this is something that you can help me with, but I really want to make sure that we take some time to figure out what are some next steps or who I might be able to talk to. Because it is absolutely as important as any other part of quality of life and really does deserve some attention.
Yeah, that's so powerful to be able to say that I need some help, even if this isn't the place that can help me. So with that in mind, if you want to sort of look out and see what information is out there in a reliable way, it used to be that there was nothing that was out there, and with the internet sort of being the wild, wild west, where can we direct ourselves as women if we want information that can help educate us, inform us, and perhaps put words to our concerns?
Well, fortunately, in the time that I've been doing this work, we have really seen an explosion of interest, specifically from folks in the cancer world, recognizing that sexual health has to be one of the very real side effects that we address, just like any other side effect of cancer. So, even now compared to a decade ago, when you get on the website for the Dana-Farber, for Memorial Sloan Kettering, for many of the large major comprehensive cancer centers, there is information about sexual health after cancer. We also know that many of the major medical societies who address women's sexual health have resources online. So if you go to that search button and you type sex and cancer, most of the large medical societies that are addressing women's sexual health, menopause, now have information for patients. Certainly, the American Cancer Society, the Macmillan Cancer Support Group in England has an amazing amount of resources that are readily available online for patients. So I'm really delighted to see that there's a lot more very good and high quality information that we can get online.
But I think that's something really important to reiterate to women as patients, that where you get your information will directly impact the quality of the information. So the importance of going to a vetted cancer site, even if it's not your cancer setting or a large cancer organization where it's pure information and no one is trying to sell you something on the internet.
I think that's absolutely correct. And to be very clear, I think that we all have to be critical consumers of
Right.
information these days. As we all know, we're all on the receiving end of so much of that. But I think certainly going to any comprehensive cancer center or something like the National Cancer Institute, certainly we know that what we're getting is good quality information.
And before I let you go, if you can just talk to women in general, that many women feel that when they're diagnosed, they're the sole survivor of what's happening to them. But in fact, everybody around them, and particularly their partners, are part of this survivorship journey. So the importance of including them in terms of what you're feeling from a sexual health point of view, if appropriate.
I think that's right. I also think that, and I say this again, with sensitivity to partners, partners get no information or support at all, right? So often what we find is that partners are hanging back because they feel uncomfortable. They don't want to hurt anyone. They don't want to hurt each other. They don't want to make anyone uncomfortable. And often that silence can be misperceived as a sense of either sort of getting tuned out or turned off, when often it's just because, again, this has never been normalized. So I think as somebody who's gone through cancer treatment, as a patient, it's also important to say to a partner, I know that nobody's talked to us about this. This has been on my mind. It might be on yours. Can we just make some time, not in the bedroom, not in a necessarily a sexual way, but just in the context of having a conversation about what our life looks like, to really talk about, just as a starting place, to say, what's been on your mind? What are you worried about? Let's find some time to work on this together. For many partners of patients, that alone is enormous because nobody's even given them permission
Right.
to be able to start this conversation.
I think it's so important that you've joined us today to really empower women to really think about the fact that this is very much part of a cancer journey or a cancer prevention journey, and that we don't want to ignore that aspect of our holistic health.
Absolutely. And to, whatever you do, just remember, as you're noting, being an advocate of our experience in terms of cancer survivorship and quality of life this is quality of life. And that even though you may have gotten the message that you should just be grateful to be alive, it is absolutely acceptable to say, it's not good enough, right? Being alive is great, but making sure that I have quality of life is actually the reason that I'm here today. So absolutely.
Well, thank you so much for joining us today and empowering women in this really important area of health. Thank you.
Thank you again for having me.